My name is Ariel Dot, and I am your moderator. We will have Spanish translation available for the duration of the session, and I'd like to bring our interpreters, Emmanuel Zambrano and Griselda Garibay on the screen.
Thank you very much, Ariel. My name is Emmanuel Zambrano, and thank you, everyone. I'm really happy to be here today. I've been part of the ACS family for almost 10 years now, and what a great event to talk about health disparities, especially during Breast Cancer Awareness Month. Now I'm going to switch into Spanish for instructions, for interpretation instructions. Muy buenas tardes a todos, les saluda Emmanuel Zambrano de la Sociedad Americana contra el Cáncer. El día de hoy voy a estar asistiendo junto a mi compañera Griselda como intérprete. La línea telefónica para usted está viéndonos, pero para poder comunicarse la línea telefónica es la siguiente: 571-317-3116 con el de acceso 546-076-933. Tiene que marcar el signo del numeral. Por favor, silencie su computador u otro dispositivo en el que esté viendo el foro. Escuche el audio del foro a través de la línea telefónica. Se necesita la línea telefónica para escuchar el audio. Griselda, la voy a presentar a Griselda brevemente. Griselda, y el audio, la plataforma es todo tuya. Yo me voy a encargar de la sesión de preguntas y respuestas. Tú estás en todo lo correcto. Griselda, adelante.
Good afternoon, everyone. My name is Griselda Garibay. I'm so happy to be here with you. Not only am I a DEI committee member, I'm happy to say that I'm celebrating my 5th year of being in remission from breast cancer this week. So hooray for me and for any other survivors out there. Mucho gusto de tenerlos aquí a todos ustedes. Mi nombre es Griselda Garibay y soy parte del Comité de Diversidad y Equidad de la Sociedad Americana de Cáncer, pero también quisiera compartir que estoy celebrando mi 5º año de sobreviviente de cáncer. Así que bienvenidos todos. Welcome, everyone.
Thank you, Griselda and Emmanuel. A couple of housekeeping items before we get started. Please make sure to keep yourself muted to eliminate any background noise and distractions. To spotlight our speakers, we recommend you clicking on the view icon in the upper right corner of your screen and clicking on speaker. Later, if time does allow, we will take audience questions for our panelists, so please save your questions for the end. And you can put those questions in the chat box. If you have a specific question for a panelist, please make sure you mention that as well. So to start us off, we are going to play a video for you. This video highlights a historic legislative win for cancer patients that passed in the Illinois General Assembly this year. Emily, could you please share your screen and play the video?
My name is Alicia Mandel. I'm originally from Minnesota, but I've lived in Hawthorne Woods, Illinois for 24 years. Met my husband 30 years ago in Minnesota. He was a resident and I was a nurse, and it's that story. We fell in love, had a few kids, moved here. Life's been great. A year ago I was diagnosed with cancer. Basically I had stage 4 colon cancer. Over Labor Day of 2020, I had 3 rounds of chemotherapy. And then after that, I think it was October, November, Dr. Kircher, she gave me a call and said, hey, guess what? Great news. And I'm like, what's the great news? My cancer's gone? Haha. And she's like, no, but we did that biomarker testing. And I'm like, yep, I remember that. And she goes, you qualified to get immunotherapy. And then she called me last Friday and gave me the amazing news, actually, that I'm sharing now publicly for the first time, because only my children know, and my husband, that everything in my colon is gone and that I had 49, and yes, 49 positive lymph nodes in my body, and I have 0. So right now I'm not calling it cancer-free. I'm just saying they have no signs of cancer in my body. I would not be sitting here if it weren't for God and if it weren't for immunotherapy and biomarker testing.
Biomarker testing. So think of it, biology and marker. Your body is a biological entity, and there are markers of normalcy, of normal aspects of your body, and abnormal. So biomarker testing is looking for those abnormal aspects of your body that would indicate cancer or guide a process for treatment of cancer.
I am a 2-time thyroid cancer survivor, and that's how they detected the cancer came back the second time in my lymph nodes, was after having that test.
I think the real big impact is personal knowledge about what you're facing, and in many cases that knowledge is going to overcome the fear and lead to success.
Which in my case, they did the test. They found that it was in a couple of the lymph nodes. We went back in, we removed the lymph nodes, and now it's gone, and the markers are not there anymore.
Biomarker testing is routine for certain populations and game-changing for the course of their cancer, whereas other populations, for a variety of reasons, are not able to equally access this.
So many people, because they didn't have the right type of income, didn't live in the right zip code, didn't know the right person, unfortunately, they didn't get the same type of care that other people may have gotten that had means.
And I don't think that's right. It can't be right. That can't be the world we live in. Why should I get something that somebody else doesn't? I don't deserve it any more than anyone else does.
So this bill is really designed to prevent that new technology from widening the disparities.
When the American Cancer Society brought this to my attention, I realized that this can help people throughout the state of Illinois.
This is everybody in and no one is left out. That's what I love most about this legislation.
I am very proud to say that I was part of this, and I think it is a very proud moment for the state of Illinois.
Illinois is serving as a leader, and I imagine that many other states will follow that lead soon to onboard biomarker testing.
Why wouldn't everybody want this? Why wouldn't every state in the United States say, let's do it? Look at what it's done for people. We could actually get a handle on cancer treatment. I mean, come on, this is what people have been waiting for years.
Less treatment, less pain, less sickness. I feel this eventually will end, the suffering and the death caused from cancer.
I want to thank the American Cancer Society for helping to put forth this legislation and for their tenacity and their hard work and never giving up.
ACS CAN is the real deal. I have not met a harder working, more dedicated group of people that are fighting on behalf of cancer patients. They fight and they fight hard, so I'm very impressed and really pleased to partner with them.
So many people's lives will be made better as a result of this legislation. Not that we found a cure, but it's about the closest thing that we can get, and we'll take that for now.
Perfect. Thank you. Well, this one is an example of the power of advocacy and policy to expand access to quality healthcare for cancer patients. So for today's panel, we are joined by a cancer advocate and elected officials who make fighting cancer a top priority in the Illinois State House. We'll be diving into how policy and advocacy can make a huge impact in the breast cancer space by helping us increase access to screenings and treatment and reduce cancer disparities. So please give a warm welcome to each of our panelists, who I am going to invite to come off mute and introduce themselves. First, we have Dr. Kathy Goss, who is Vice President of Cancer Control, American Cancer Society, and Cancer Advocate. Kathy?
Yeah, hi, thanks Ariel, and great to see you all. I'm thrilled to be a part of this panel. So I am new as the American Cancer Society Vice President for Cancer Control in the North Central region. I've just been in the role for about 6 months. I came from the University of Chicago Medicine Comprehensive Cancer Center, where I was a breast and colorectal cancer researcher and then turned administrator. I'm a longtime cancer advocate, volunteering for lots of organizations, including ACS for almost 20 years, and ACS CAN. So I am thrilled to use my lens as a former researcher and advocate, and then now I'm being a part of the American Cancer Society for this panel discussion today. So thanks again for having me.
Thank you. Next, we have State Representative Camille Lillies. from the 78th District, representing Chicago, Elmwood Park, Franklin Park, Oak Park, and River Grove. Representative Lilly?
Hello, happy Breast Cancer Month. And what I mean by that is we're all coming together to address an issue that are affecting our lives every day. So I'm saying it's happy because we're all doing it together. With that, again, I'm State Representative Camille Lilly of the 78th District here in the state of Illinois. My background is healthcare. I am a healthcare administrator, and I have the opportunity, and I believe it's the mission to go forth and to influence healthcare, access to healthcare here in Illinois. I am the chair of the Approach Human Services Committee in the House here. And I am honored to be a part of all of the solutions and ideas and the outreach and the education that allows us to give people a second chance or a chance to a quality life. So I'm excited to be on the panel, and thank you for inviting me. And I look forward to the conversation.
Thank you. Next, we'd like to introduce State Senator Laura Ellman from the 21st District, representing Bloomingdale, Carroll Stream, Carlisle, Naperville, Warrenville, West Chicago, Winfield, and Wheaton. Whew, that was a mouthful.
Thank you, Ariel. Yeah, my name is Laura Ellman, and I still consider myself a freshman senator. I had never run for office until I was actually 50 when I decided to run for office. That was, okay, I'll give my age. That was back in 2016. And, you know, since then, obviously I made it, but the greater success, I think, was learning from it and adding to my life experience. This is just something, you know, my life took a different direction after I decided to make this change. And I've really enjoyed it. I am proud and humbled to serve my district and to be part of the legislature. But in March, just about 6 or 7 months ago, something new happened. I was diagnosed with breast cancer after, and this is a story of delayed screening. So if there's anybody who is thinking, it's been 15 years since my mammogram, maybe it's time. It's time. That's how long it had been for me between mammograms. And so since then, I've been undergoing a treatment regimen. I'll be talking about that later, I'm sure. And I'm still in it. I'm in between surgery and radiation. And, you know, this too has just added to my experience. You know, I am very lucky, you know, in so many ways, but it was caught early enough to be stage 3 and not my experience in life here on Earth. So thank you very much. I really look forward to hearing what people have to say.
Thank you. Thank you so much. Next, we have State Representative Thaddeus Jones from the 29th District, representing Chicago, Calumet City, Harvey, South Holland, Lansing, Chicago Heights, Steger, Crete, and Monet, and Mayor of Calumet City.
Thank you, Emily, Ariel. Senator, I would have to say that your story is courageous, but you know, when you're not a freshman anymore the day you get sworn in. So you're a seasoned veteran now. So it's, you know, you're a seasoned veteran. Just like the honoring of Mary Flowers. And I just have to say that she got honored on the floor yesterday because of her courageous work. I got kind of jealous because Mary got honored, and, you know, Mary has been all over all of us, but she deserves it because she fights for everyone, but she particularly fights for breast cancer and cancer. So that honor was so deserving to her. My name is Thaddeus Jones. I'm a 29th District. I have the opportunity to represent not only my district, but also represent my mother. Senator, my mother's in your same category. This is her 3rd battle with cancer, and she got diagnosed and had surgery at 84. So I understand what you're going through as I you know, definitely hear my mother every night with the pains, but also hear the joy of her still being alive and able to tell her story. So with me being the chairman of insurance, the biomarker bill came through our insurance committee, and I was proud to support the bill and proud to fight for breast cancer and proud to fight for not only everyone learning about and supporting and advocating, but just more that we can do in the insurance committee. Leader Lily is on the insurance committee as well and serves the dual role of chairman of human services. So I think both of our committees have so much synergy in the fight with cancer. And of course, Senator, what you do on the other side. Everyone knows that we do all the hard work in the House and the senators just sit back and relax. So we are happy to pass all the strong bills in the House of Representatives and then send everything else over to the Senate because we do all the hard work in the House. But I am so happy to partner with not only American Cancer Society, but you know, the senators and Camille to make sure that we keep American Cancer Society and what we're fighting for at the forefront. So I will talk more about my story and the fight as we get forward. But thank you for allowing me to introduce myself.
Thank you. Thank you so much. All right, we're going to go ahead and jump right into our panel. Audience, I encourage you to drop any questions that you have for our panelists in the chat box. So I'm going to start off with one question for everyone. Starting off with Dr. Kathy Goss. How and why did you become a cancer advocate?
That's a great question. I think for many of us on this call and on this panel, and what you've already heard, is that cancer is personal. And for me, I mentioned that I was a cancer researcher, and I love that work. I was very passionate about it for many, many years. I ran a research lab that studied the molecular events that lead to breast and colon cancer, very fulfilling. But when I got the chance to advocate on behalf of ACS CAN, and my first experiences when I lived in Ohio and I was at the University of Cincinnati, I was so inspired because I too had a personal story that got me into cancer research in the first place. I lost my father to brain cancer when he was only 48 years old. And I was in college. We lost him very, very quickly. It was very aggressive. And it changed everything for me. And so for me, getting involved in advocacy allowed me to tell my story and help educate legislators. Of course, the legislators that we have on this panel, you know, they don't need much education, but what you find is that not everyone sort of knows how the cancer research community or cancer research funding works, for example, or policies in which that are really supportive of cancer patients and their families. And so for me, when I was a researcher and became a cancer advocate, it was a great way for me to give back to ACS, but to be active and have my voice heard. And then I think being a researcher, I also brought some credibility to the table as well, because I could speak to how important the research fight was. And of course, and then just sharing your story. I think what I heard in the video that you shared, which I just love, Dr. K from UIC, the Cancer Center director there, mentioned about cancer advocates. They fight and they fight hard. And that was the one thing, it always inspired me to be around cancer advocates that are choosing to use their voice in such a positive way. And for me, it then fueled my work in research and then in Cancer Center administration, because we all are in it together. So I've been very privileged to be a volunteer and a cancer advocate for many, many years.
Awesome, awesome. Thank you for sharing that. I will go to Representative Lily. Can you explain what is your personal connection to cancer and how does that influence your role as a lawmaker? you're on mute.
Yeah, I'm gonna have a t-shirt saying I'm on mute, but anyway, my personal connection has a lot to do with today. My father at the end of session in June was diagnosed with stage 4 cancer. And it changed my life immediately. And it has been a journey. But I am honored to be able to live out my theme in life. If you don't have your health, you don't have much else. And when you walk in that vein, you get the opportunity to work alongside advocates like the American Cancer Society, Senator, I made you a senator, Representative Jones or Chairman Jones, Senator Ellman, where we are focusing in on making, giving access and opportunity to people who have been diagnosed with illness that they just didn't anticipate. My experience as a healthcare administrator at Loretto Hospital for the past 36 years has allowed me to have firsthand knowledge of people who need healthcare and their challenges in accessing it. And the challenge is to have better health outcomes. I sit on many boards of Westside Health Authority, which is a community grassroots organization that addresses healthcare from a collaborative way, but from a grassroots effort. It's also important as the chair of the Women Caucus here in the state of Illinois with 39 strong, who are dedicated to, yes, get that right. I think we're the largest House Women Caucus in the country. But we're dedicated to addressing families here, where we're looking at addressing their health needs with compassion and dignity in a dynamic way, you know? And we, as we just saw in the video, and as we honored Leader Flowers, very dynamic and compassionate way to say we care about people here in Illinois and we want to work together. So my personal today is my journey with my father with stage 4 colon cancer. And I've learned so much about the needs in long-term health care. And I've learned so much about the, he did take the biomarker. There you go, my biomarker test, but he was not eligible. So his fight is real. And I get to advocate on behalf of him as a legislator, but I do know so many people don't have that access or that person in their lives because they may be the only one in their life and they're dealing with cancer. So I am honored to be here with the American Cancer Society and all your friends. That's why I said we're doing this together, and I'm happy to be a part of that.
Yes. Thank you so much for sharing that. Senator Ellman, you shared a bit about your personal experience with breast cancer. Can you talk a little bit more about that and how that's influenced your role as a lawmaker as well?
Sure, thank you. So, you know, for me, it has been a journey, as Representative Lilly has described, and it's really been a journey that has kind of followed 2 tracks. Obviously, the physical journey. You know, I have likened, instead of being a warrior, I sometimes felt more like a battlefield because the treatments are sometimes very intense, you know, and they take up, if not, they take up a lot of space in one's life. So there's the physical, but then there's the space in one's brain, the psychological, and that too has been a journey for me. So, you know, I've learned so much. I mentioned this in my opening remarks about, well, first of all, about cancer, but also about acceptance, about gratitude, and, you know, about the support and how important the support and help of other people have been. I've just been overwhelmed by by people who have come forth and provided me support, even in the chat box right here, personal, private things that say, we're praying for you, we're supporting you. That was really quite unexpected. And it's been lovely, but it's also so impressive because so many of these, shared stories of survivors are from people I had no idea had gone through it. Strong women, who are badass women and that I had never even suspected came out in support of me and helped and told me kind of what to expect. So that's been part of my journey, but it's certainly been, a roller coaster with ups and downs, both physically and psychologically. But, again, as far as my role as a lawmaker, obviously I'm more in tune with what's going on, as far as advocacy. In fact, there's some bills I want to check and see, and I'd love to get your input on it on durable goods such as compression sleeves and having those being covered by Medicare and across the state. But also just the research and having data-driven policy going forward. I know, thank you to Dr. Goss and the research that you've done. I know that there's a lot of research going on, not only on the physical, but also on the social and probably the psychological, but there is even research going on those social determinants of health and specifically on cancer outcomes that I'm looking forward to learning more about. Thanks.
Thank you. Thank you so much. Representative Jones, you also talked about your mother, your personal connection to cancer. How has that been influencing your role as a lawmaker?
Thank you. I was once told that, when you meet people, you have to treat them like everybody is God's children. And you go down from there, and that's how you deal with people. Even if they're your strongest opponents, you still have to have love. And one thing that we have to realize that is cancer has no gender. And when my mother first told me, as men, we try not to be emotional about, the stories that get told to us by our parents. And when my mother told me about, in our family, about the third bout, we didn't know about the first and second bout. We knew about the third battle when she told us. And we all broke down because we knew that we had to do something. And I think just coming into this, because, I was not engaged in the battle with breast cancer and cancer in general, because it didn't impact anybody in my family, but I knew I was still a supporter. And I think now I've ramped it up a notch because I know how emotional it is. And that's what people have to deal with. You have to deal with the emotional and the mental portion of it. And for some people, it's hard. I know it's hard on me, hearing my mother scream at night and being in pain. So I think it's important that we have a conversation and discuss it. And, tell our family stories and everyone else's stories, because all of us are here today because we have a story. And not only sharing those stories, but how we advocate for each other and with each other is, I think, important for survivors. It's important for legislators. And I think it's important for people to just have a conversation. Sometimes people are just scared to talk, and I don't know why, but breaking down those barriers is always important to success, and always important to being a good legislator.
Right, thank you. I'm going to move back to Dr. Goss. Can you talk about how the American Cancer Society's cancer control and advocacy policy team work together to advance breast cancer health equity and other priorities?
Yes, absolutely. And I would like to just first say to all of our other panelists for really sharing your personal stories. That's so meaningful and really just goes to show where your heart is and why you are such important champions. So thank you for that. But I appreciate the question because as Ariel said at the top, I'm the Vice President for Cancer Control, Regional Cancer Control at the American Cancer Society. And cancer control, you may say, well, what does that mean? And you know, and really that's our team dedicated to the mission at the American Cancer Society that's focused on reducing the burden of cancer, both incidence or mortality. So what are those things that we can do, mainly from a public health perspective, working with our communities, working with all of the stakeholders across the board from various sectors to come together to eliminate, to reduce the incidence of mortality due to cancer, the cancer burden. And of course, we are very concerned about making sure that we are not, that we are focusing on those populations and communities that have been traditionally excluded. So that part of our work, focused on health equity, is incredibly important. So it's everything from screening and prevention and early detection work, working with health systems and our cancer coalitions to across in our communities and across the state and nationally to lower the burden of and mortality due to cancer. And our team also helps facilitate access to care, so patient services that the American Cancer Society provides. But all of that is directly linked to policy. We cannot do the work that we do in our cancer control team if we don't have synergy with our policy efforts in ACS CAN. And quite frankly, the third piece of our tripartite mission, which is research. They're all linked in, as Senator Ellman said, they're all linked. You know, we need to understand the challenges through research. We need to implement change through cancer control, and then we need to sustain that change through policy. So this really requires this bi-directional work and interaction. And so that's why it takes us all to come to the table. And that's why our cancer control team, their focus is on, you know, that work that they have been trained in and are real experts in, but they work hand in hand with our ACS CAN colleagues like Emily that's on the call, and of course Shayna Cruz, who is our government affairs lead in Illinois. So this is a partnership and a lot of collaboration.
Thank you. Yeah. Dr. Goss mentioned policy and screening and prevention. So Representative Lilly, I'm going to turn to you. Can you talk about what the role of lawmakers are in expanding access to prevention services such as breast cancer screenings?
Yes, thank you. The role is really exactly what Kathy noted. We are partners, and it takes us to listen and then sustain what is needed for the people in the area of access to healthcare. And when we spend our resources, meaning taxpayer resources, on research, on outreach, on treatment, and we demonstrate a lot of this in our budgets, but we also have the commitment of people and legislators like ourselves to join the cause, if you will, and the advocates like American Cancer Society. And when you look at what we're doing, and which is important you do, you can look at our budget and you look in the Department of Public Health, and we have funded in FY21 over $600,000 for breast cancer research. And we need to continue to do that, and we need to do more. Also in FY21 and FY22, Illinois Department of Public Health, we gave $7 million for breast cancer and cervical screening. That's our way of saying this is our part and our role based on what the people are telling us where the needs are. We, again, in public health, over $14 million in breast cancer, and we're in the minorities communities where we know their health concerns are disproportionate. and their disparities are so great. We, the legislator, must be that entity that fills that gap. We also, for 21-22, we have over $2 million again in research and services for breast cancer victims. So as we work together, our role is to sustain the research that allow us to fund the resources and services needed to bring quality of life for all Illinoisans. So I believe when I get this opportunity to do this, when I come to Springfield, that's my blessing. And I'm just honored to work with all of the representatives in the House and in the Senate to continue this work.
Yes, thank you so much. Yeah. Representative Jones, you know, Representative Lilly just finished speaking about how we want quality healthcare for all Illinoisans. Can you talk about how you are working to expand access to insurance and quality healthcare to more?
It's a great question. And part of that access starts with our role in Get Covered Illinois, our role in working with the Department of Insurance to make sure people who don't have access and can't afford it, that they're able to work with the department to do that. Each of the reps and senators, we hold these Get Covered Illinois. We haven't been able to because of the pandemic, but part of driving people to Get Covered Illinois allows them to know that there's help out there and there's resources. Representative Lilly just mentioned all of the funding that we put into different categories, but we also put money, expanded money in colonoscopy as well. And the biggest thing that we did this year, all of us, was the telehealth bill. You know, that bill signified a significant historical piece in Illinois in moving us forward, because all of us learned from the pandemic that we need to have telehealth services. And that telehealth services is going to save lives. And we know that through our telehealth bill that we passed, we all did a great job. The 118 reps and the 50 or so senators that did it as well. We all did a great job in listening to the advocates and listening to the people who need help, just saying that telehealth was important in Illinois. So moving that access piece from just talking about it to doing it, even though the telehealth bill, we had some challenges with landing the plane, but I think we all worked together to make sure that we knew what the goal was, and that was to expand access. And I believe as chair of insurance and of course, Leader Lilly as chair of human services, our goal was to make sure that people knew about what we did. And we're going to continue to do that. It doesn't just stop at one bill, because there's going to be many more things we're going to have to tackle together in the upcoming session.
Thank you. So, you know, we've talked about policy for breast cancer screening, and Senator Ellman, you talked about looking at compression garments and seeing how we could get that covered by insurance and things. Are there any policies that you see, Senator Ellman, on the horizon that will benefit breast cancer patients and survivors?
You know, that's a good question. I don't have anything really specific right now, but you know what Dr. Goss had mentioned is that kind of that iterative chain of events between research and legislation, research and legislation. You know, the more we learn as we go, as even on the physical level, the social level, the better we'll be. I mean, there's a lot of research just on, you know, the molecular level of cancer. If we can, you know, unlock more secrets about how that works so that we can have earlier detection or maybe even prevention, that will not only improve people's lives, I mean, immeasurably, but it will also lower costs of insurance healthcare costs for our state and the country. The more we learn about social determinants of health and barriers to to healthcare and trying to unlock those so that there's equitable access to screening, fair and equitable diagnosis so that all patients are listened to in the doctor's office, access to facilities. You know, it shouldn't depend on your zip code on where you can, on what you can get. As we tackle those two will help people's lives immeasurably and reduce overall costs for the state and for our country. So, you know, it really depends. As we learn, we've really got to follow up with policy as we go.
Thank you. Yeah, the data from research is important to know what actions we need to take to improve life, what policies we need to start trying to move forward. I love that. I'm going to just give one more question. If you have a question, please drop it in the chat. This question is going to go to Dr. Goss. You mentioned stakeholders before. Outside of ACS, who are other stakeholders that are involved in our fight against cancer? And how do we together work to achieve more wins for cancer patients and survivors?
Yeah, I think Representative Lilly said it best when she really emphasized that we're all in this together and we cannot do this alone. And so certainly there are stakeholders that have already been mentioned on this call. Of course, legislators, our state and local departments of health and cancer coalitions, our health systems, our primary care and FQHCs, payers. Representative Jones mentioned payers. They have to be at the table. We need corporate support. We need our advocates and volunteers. Basically, these challenges are huge, especially around health equity. These are things we know what some of the problems are now, right? Research has been done. We know what the issues are and the barriers, but to actually have solutions, we've got to come to, for real change, we've got to get everyone at the table and identify what are those things that are actually going to move the needle. Learn from others who have had successes. If we've had some success in a breast cancer policy, let's make sure that it's broadly accessible or broadly applied to other policies. We talked about the biomarker testing legislation, which was a huge win here in Illinois. Let's make sure that that was the first state to take this on. Let's replicate it in 49 other states. Let's get it done. And that's how it takes a coalition of all of these folks who are like-minded. We may not agree about everything. I can tell you, we don't agree about everything, but there are areas of synergy in which we all agree on. And, we've got to have this sense of urgency, especially like around screening and access to care. Now is more important than ever because of the health inequities and disparities and results of the pandemic that we've seen. So I would love people to sort of put aside their personal sort of, agendas and say, what can we do together? And ACS, I think, ACS can play a really important role as conveners and bringing everyone to the table. And there are other community organizations. Of course, our community partners and other advocacy groups are so critical and are well positioned to help us get there.
And Ariel, before you go, I'll just say this, that one thing about insurers, because I see a question in there about how do we bring the insurers along. I think, ACS should use the power that it has to leverage the insurance companies to come to the table because they are scared of you guys. They're scared because, number one, they don't want to say no, but also they know that the power of people behind you and the power of what we're fighting for is stronger than their individual policy convictions. So as we start moving that conversation along of what's needed, and Senator Ellman, there was a bill last year about, it was a bill about the, Camille, correct? There was a bill in our committee about the compressors. So as we start moving this discussion forward, bring those insurance companies and say, look, this is our agenda for this year. You're either with us or against us. And, you know, we have the power of conversation to make sure that they understand how important this is. So I just wanted to piggyback on Dr. Gross's and the comment in there about how do we bring the physicians along as well.
Thank you so much for answering that. Yes. All right, everyone. This was an amazing way to wrap up our impactful event today to celebrate Breast Cancer Awareness Month. Thank you to each of our state lawmakers for championing policies that support cancer patients and survivors, and to Dr. Goss for being a powerful cancer advocate. So we hope everyone leaves here today feeling empowered and ready to get involved with this fight. So this will conclude the Fighting for Health Equity Breast Cancer Screening Forum. Thank you all for joining us today. And just a friendly reminder that ACS and ACS CAN will be following up via email to share a survey with all participants. I think we're also dropping it in the chat. Thank you for that, Emily. And we strongly encourage everyone to complete this survey so that we can continue to find more ways to work together in our fight against breast cancer. Thank you all and have a great rest of your day.
You too. Thank you for having